behalf of my honorable colleagues present here and the Department of Health and Family Welfare, take great pleasure in collecting of these ambulance, hearse and other vehicles for public service.
Prime Minister Narendra Modi today virtually launched the Swasth Nari, Sashakt Parivaar Abhiyaan, a nationwide health campaign focusing on women and children. In Nagaland, the state-level launch was held at the Capital Convention Center, Kohima, where Chief Minister Neiphiu Rio formally inaugurated the program. The campaign will run from September 17th to October 2nd, covering 528 health units across Nagaland, including district hospitals, community health centers, urban and rural wellness centers, and AYUSH facilities. Mobile medical units will also reach remote areas. As part of the launch, the state received 26 ambulances, 12 hearses, and 6 rapid response team vehicles, funded under NESIDS. The Chief Minister flagged off the vehicles at the event. 2 integrated public health laboratories in Mon and Dimapur were also virtually inaugurated under PM-ABHIM. Chief Minister Rio said women's health is central to the well-being of families and communities and assured that the government will continue prioritizing healthcare. The event concluded with a vote of thanks by Health Minister P. Paiwang Konyak. Free health service packages were also made available at the venue. The Swasth Nari, Sashakt Parivaar Abhiyaan is part of the National Health Mission and aims to improve maternal and child health across the country. प्रधानमंत्री नरेंद्र मोदी ने आज स्वस्थ नारी सशक्त परिवार अभियान का वर्चुअल शुभारंभ किया। यह राष्ट्रव्यापी स्वास्थ्य अभियान महिलाओं और बच्चों की देखभाल पर केंद्रित है। नागालैंड में इस अभियान का राज्य स्तरीय शुभारंभ कोहिमा के कैपिटल कन्वेंशन सेंटर में हुआ, जहां मुख्यमंत्री नेफ्यू रियो ने कार्यक्रम की शुरुआत की। यह अभियान 17 सितंबर से 2 अक्टूबर तक चलेगा और पूरे राज्य के 528 स्वास्थ्य केंद्रों को कवर करेगा, जिनमें जिला अस्पताल, सामुदायिक स्वास्थ्य केंद्र, शहरी व ग्रामीण हेल्थ एंड वेलनेस सेंटर और आयुष केंद्र शामिल हैं। दूर-दराज इलाकों तक पहुंचने के लिए मोबाइल मेडिकल यूनिट्स भी तैनात की जाएंगी। कार्यक्रम के तहत राज्य को 26 एम्बुलेंस, 12 शव वाहन और 6 रैपिड रिस्पांस टीम RRT वाहन उपलब्ध कराए गए, जिन्हें मुख्यमंत्री ने हरी झंडी दिखाकर रवाना किया। इसके साथ ही मोन और डिमापुर जिला अस्पतालों में 2 इंटीग्रेटेड पब्लिक हेल्थ लेबोरेटरीज का भी वर्चुअल उद्घाटन किया गया। मुख्यमंत्री रियो ने कहा कि महिलाओं का स्वास्थ्य परिवार और समाज की मजबूती के लिए अत्यंत आवश्यक है और राज्य सरकार स्वास्थ्य क्षेत्र को सर्वोच्च प्राथमिकता देती रहेगी। कार्यक्रम का समापन स्वास्थ्य मंत्री पी पैवांग कोन्याक के धन्यवाद प्रस्ताव के साथ हुआ। मौके पर निःशुल्क स्वास्थ्य सेवाएं भी उपलब्ध कराई गईं। स्वस्थ नारी सशक्त परिवार अभियान राष्ट्रीय स्वास्थ्य मिशन के तहत चलाया जा रहा है और इसका उद्देश्य मातृ एवं शिशु स्वास्थ्य सेवाओं को मजबूत बनाना है।
लेकिन माताओं बहनों, आज 17 सितंबर विश्वकर्मा जयंती पर मैं आपसे कुछ मांगने आया हूं। गर्व से करो, गर्व से कहो, गर्व से कहो, गर्व से कहो। साथियों, इसी भाव के साथ आपको फिर से अनेक अनेक शुभकामनाएं देता हूं और मैं मेरी वाणी को विराम देता हूं। बोलिए भारत माता की, भारत माता की, भारत माता की, बहुत बहुत धन्यवाद.
With a heart full of gratitude, Lord God, we thank you for the gifts of life and health. Initiative of Health Camp, which services daughters and children in every home.
Honorable Minister for Power and Parliament, Shri Keynote. Honorable Minister Shri Mr. Zamisa RD, Minister for RD. Honorable Minister Shri C.L. Johnson for Environment, Forest and Climate Change. Thank you. Thank you.
Pleasure to be here today to lend our part in the state, this Swasth Nari Sashakt Parivaar Abhiyaan, a nationwide campaign with the inspiration theme, Healthy Women, Empowered Families. Before I go into our topic, today is also a moment of joy and celebration for all of us as it marks the birthday of our Honorable Prime Minister, Shri Narendra Modi ji. On this special day, on my own behalf and on behalf of the state, join the entire nation in extending our warmest greeting and best wishes to him. May he continue to guide our nation with his visionary leader as we celebrate this occasion. Let us also renew our commitment to realize the dream of the Honorable Prime Minister, a vision of Viksit Bharat 2047. To transform India into a developed nation by the time we mark 100 years of India independence. I also wish to place on record my sincere appreciation to this meaningful initiative, Swasth Nari Sashakt Parivaar Abhiyaan, which is aimed at improving women's health and in turn empower families and our community across the nation. Health and empowerment of women are central to the progress of family, community, and the nation at large. When women are healthy, educated, and empowered, the entire society benefits. This campaign being organized from 17 September to 2nd October 2025. Culmination on Gandhi Jayanti is a timely and significant initiative of the Ministry of Health and Family Welfare. As we heard, launching by Honorable Prime Minister, we heard him, but most of us, we did not understand. This campaign will focus on health and nutrition of women, adolescent girls, and the children with the aim to strengthen early detection and treatment linkage of various diseases. They deliver essential health services to the last mile, promote awareness and encourage families to adopt healthy lifestyle. Across India, this campaign is being organized at health and wellness center in all the centers of healthcare with a focused approach to address the specific healthcare needs of particularly women and children. Nagaland, the campaign will be conducted, I believe as mentioned, in 500, including 12 district hospitals, 26 CSC, and 18 UPHC, and 97 HWC, PSC, 333 HWC, NSC, and 49 Ayush HWCs. During the campaign fortnight, health camps will provide a comprehensive package of special health services, including screening for non-communicable diseases such as high blood pressure, diabetes, and cancer. Reproductive and child health services, including ANC, PNC, immunization, counselling, and anaemia screening, nutrition, menstrual hygiene awareness, hemoglobin testing, and IFA calcium supplementation, tuberculosis screening and referrals, enrollment of Diksha Mitra, and counseling, mental health awareness and counseling. I'm happy to note that Nagaland Institute of Medical Science and Research, NIMSR, will be actively involved in providing specialist services during the health camp in the state. I also appreciate the participation of private hospitals and clinics whose contribution will help extend the reach of this Abhiyaan to more people. I also want to request our elected members to fully involve and supervise these campaigns so that everybody gets the opportunity. And that request goes to our civil societies and the churches, which will be very important. This campaign is an important step towards the vision of healthy, empowered, and Viksit Bharat by 2047. I urge all citizens, especially women, mothers, and young girls, to take full advantage of these services being offered. Let us work towards and together to build healthier families and a stronger Nagaland. I extend my heartiest appreciation to all the doctors, nurses, ushers, Angawadi workers, and community volunteers who are the backbone of this campaign. Your initiative, a difference and a grand success. Let us rededicate ourselves to the goal of universal health coverage and ensure that no one is left behind in our common journey towards the healthier and more prosperous future. I wish the Swasth Nari Sashakt Parivaar Abhiyaan a great success in our state. Thank you and Jai Hind.
us and motivated us for working further hard for the state. To create a cohesive and efficient diagnostic and surveillance network for the public health and to improve the health outcomes of the integrating diverse laboratory functions like infectious diseases, testing, clinical biochemistry and pathology under one roof. Integrated public health laboratories, labs are being constructed under PM Abhiyaan scheme. This integration enhances the disease surveillance, streamlines resource allocation and facilitates rapid response of outbreaks and pandemics. So these IPGL labs will be monitoring the disease pattern, and then before anything becomes outbreak or a pandemic, we will identify and will be able to act in advance. So that we have completed 2 such labs at Dimapur and Mon district. So may I have the honor of to request Honorable Chief Minister Dr. Neiphiu Rio for virtual inauguration of these labs.
Joint Secretary, Ministry of Health and Family Welfare, Government of India, Chief Secretary of Nagaland, Home Commissioner, Commissioner Secretary to the Chief Minister, Commissioner and Secretary, Health and Family Welfare, all HODs and AHODs, Principal Director, Health and Family Welfare, Deputy Commissioner, Kohima District, Mission Director, NHM, officers and staffs from the department, media friends, students, ladies and gentlemen. Very good afternoon to all of you. It is my proud privilege moment to propose a word of thanks on this momentous occasion of the state-level launching of Swasth Nari, Sashakt Parivaar Abhiyaan, health campaign with service for women and children. At the threshold, I, on behalf of the state of Nagaland, would like to express my sincere gratitude to the Honorable Prime Minister of India, Shri Narendra Modi ji, for launching the Swasth Nari Sashakt Parivaar Abhiyaan. I also express my deepest gratitude to Honorable Chief Minister for gracing this occasion and for his steadfast leadership and support in advancing the health agenda of our state. For the information of this gathering, our state has received 26 ambulances, 12 hearse, and 6 Bolero Rapid Response Team RRT vehicles funded and procured under NESIT for strengthening surveillances. The 6 Bolero RRT vehicles are earmarked for state Mon, Dimapur, Pek, Tuensang, and Zunipoto. Honorable Chief Minister will officially flag off the ambulances, hearse and RRTs right after this program. Further, we also have witnessed the virtual inauguration of the 2 integrated public health laboratories, that is in Mon and Dimapur District Hospital under PM Abhiyaan shortly. All this was made possible under the initiative of our Honorable Chief Minister, Shri Dr. Neiphiu Rio. These thoughtful steps will go a long way in improving health care delivery, ensuring timely medical support and providing dignity in service to our people. Sir, your leadership and commitment towards strengthening the health sector continue to inspire us and bring hope for a healthier and more resilient society. I extend my heartfelt thanks to the Joint Secretary Rajendra Singh Ji, Ministry of Health and Family Welfare, for being with us today. Your support and encouragement add immense value to this noble initiative, and we are truly honored by your participation. I also thank Reverend I. Tereng, State Chaplain, for evoking God's blessing and setting a graceful tone for today's program. Sincere appreciation to the Commissioner Secretary Health and Family Welfare, Sri Anup Kinchi, for graciously chairing the function and for providing invaluable guidance and encouragement which has greatly enriched the entire proceedings. I thank to the officers and staffs of the Department of Social Welfare, Rural Development for setting up stall alongside this campaign. Your participation showcased the collective commitment towards the well-being and empowerment of women and families. To all the dignitaries, senior officers, health workers, community representatives, development partners, media fraternity, and organizing team, I thank you very much for your valuable participation and contribution towards the success of this launching program. Today's event marks not just the launching of a campaign, but a renewed pledge to work collectively for healthier women, stronger families, and a more empowered society. With these words, I once again thank each and everyone present here and seek your continued support in taking this Abhiyaan forward with dedication and commitment. Thank you, Jai Hind.
Supported order and state village fleet of 26 ambulance, 12 first vans and 6 RRT vehicles which were funded under DSID under the project titled as Health Preparedness for COVID-19 in COVID-19 Management, and with special reference to the third wave of pandemic for the state of Nagaland, which was financed in the financial year 21-22. This ambulance will be deployed in all the remote areas of our state in all the health units, and the 12 first vans will be in the 12 district hospitals, including Nagaland. Then the RRT vehicles will be in the different zones, namely Kohima, Dimapur, Mon, Zanepto, and Peg. We would like to extend our heartfelt gratitude to Apex Motors for this CSR initiative in gap funding the price difference due to cost escalation during the intervening period. We also like to extend our deepest appreciation to the Ministry of Donor, the implementing agency, and all those who work tirelessly to make this happen, especially to the Department of Planning with this transformation. Today's flag off is not just about flagging off the vehicle, but about the values and the commitment to the people that no citizen is left behind, whether in moments of crisis or in their last and final journeys. Let this vehicle roll out, not just on roads, but in the hearts of the community and in the people of Nagaland, carrying care, comfort, and compassion. Thank you. In view of the disruptive road between Kohima and Dimapur, we do not bring all the vehicles from Apex Motor Stockyard, but therefore only we arrange 5 ambulance, 2 hearse vans, and 1 RRT vehicle. So I now take the privilege in inviting our Honorable Chief Minister to do the honors to flag off the vehicle.
On behalf of my honorable colleagues present here and the Department of Health and Family Welfare, take great pleasure in flagging of these ambulance, hearse, and other vehicles for public service. God bless.
Thank you.